Well, we're back for our last segment of our video for our 40th anniversary of the nursing program. And I have the privilege now of introducing some of my colleagues who have more recently served as our nursing program directors and leaders. And while it's important to know, where we came from, and which was, an awesome experience for me, because we established ourselves in the community, but building on those strengths, but also learning from our mistakes. I think it's important that we're able to share our vision of where we think WCC's nursing department is heading. So, because WCC as a learning institution, has served as such a key force in educating our community workforce, especially in healthcare careers. And of course, our reputation precedes us. I think we can all agree on that. So here to share some perspectives, insights about the nursing program today, now and for the future, I have with me to my right, Valerie Greaves, who is in the a new role, I should say, Dean of Health Sciences. And to my left, Mary Burns Coral, who as of May 4th, 2015, assumed the role of Department Chair for Nursing and Health Sciences. So we'll start off with Val because Val's actually had a pretty long history here at WCC. I shared in the first segment how I recruited you to develop the curriculum for the CNA program back in mid-90s, mid to late 90s.
Probably.
And now you assumed the full-time lab coordinator position, 2007, before moving into the department chair role, and now to your position as dean. So if you could share some of the things that you've seen change in your time in the department, and really, maybe try to share some of the visions that you see for us moving forward in the 21st century.
It was interesting because we were just kind of talking about how sometimes things circle around and come back from the previous things we were just listening to with some of our faculty that were here years ago. But the focus now, we definitely have seen so many changes in healthcare and in our community. We have to respond really quickly to things. And one of the biggest things that we're working on is accommodating the community's need for bachelor's prepared nurses. So we're doing this in a variety of ways, and one of them, Gloria already mentioned, was what we initially started years ago, was a 2+2 program with Eastern Michigan University. And we're glad to say that's still really strong, and our partnership is real strong with them. But we just recently will be adding, and actually this winter semester, this fall, we'll be taking our first cohort of another 24 students from EMU that'll be coming to Washtenaw to take their get their AD in here at Washtenaw and then complete at Eastern for a BSN. So it's a collaborative program. It'll be the first time that we've done this.
Too, at the same time.
Yes.
Correct.
And
They'll be taking courses spring, summer through EMU most of the time except for the last segment of their courses for their BSN. So in 8 semesters going year-round, they will have their associate degree in 7 semesters, and in their 8th semester they'll have their BSN. So that's pretty awesome that we have this opportunity for growing our program. And we're also looking at exploring possibly meeting the needs that the community has identified as more RNs too. So we have a lot of LPNs that are in the community, and I know that's kind of circled around because you've done that before, but there seems to be an even greater need for more RNs. So offering a transition from LPN to RN and then have them finish up their last 2 semesters at Washtenaw Community College and get their ADN. So it's so exciting to see some of these opportunities that are coming about. And as we're hiring new faculty, we're looking at more masters prepared for all of our lab faculty, for our clinical faculty.
Part-timers
and
now,
part-timers
which we never
now.
required.
You're right, and also now we have some PhD candidates that, like Val's working on her DNP, so we have, we're seeing a difference in our program, totally different than what we used to.
I'd like to also mention that being involved with the community is more important than ever before too, because as our program expands and we have more nursing students, we have to be able to work well within the community and partner within the community for these clinical spots that we need. So and we've had these programs for years, but we're continually to try to improve them and expand them with the VA, St. Joseph Mercy Hospital.
Hopefully U of M.
U of M, yes. So continue to work on that.
It's funny you should mention that because, talking about, why I think the need to have better prepared faculty at a master's level and higher is so important. Phyllis spoke to how when she worked as a nurse in the old St. Joe's, she would be the only RN on a 2-wing floor. And so we all know the acuity and the type of patient that we're actually dealing with out there in hospitals as well as other healthcare settings. I mean, their needs are so much greater, so much more acute, and we have to have that higher level.
And that, Gloria, you mentioned a really important thing. We've had to change the way that we teach our students. We now have a simulation lab with human simulators. They have to practice in that lab before they're able to go out in the clinical. We have EMRs that the students have to now be familiar with. Electronic medical records. But students need to know how to use those because when they go into the clinical setting, they're going to be expected to be able to use those and know how those work. So we're bringing all that in the lab, and we have to make sure that we're teaching them things that are current in practice.
Plus, we have the health initiatives too, right? That we're now doing clinics at some of the senior centers, at the Ys in the community, meeting the community needs for education on healthcare. So our fundamental students are involved in that. Some health promotion students have been involved with our 2+2 program, and also our mental health nursing students have been involved in that. So that's huge, and we're thinking of expanding those clinics and growing those clinics and including more of our students in those health promotion clinics.
And Mary, this kind of came out of our affiliation. We're now charter members with Washtenaw Health Initiatives. And so out of this, we saw a great need in our community for our students to reach out to the underserved populations and offer screenings, offer free education, which is a win-win for us because these are also utilized as clinical hours for our students. And we're working towards also the initiative of Healthy People 2020 by doing this.
We probably should mention too, for how long have we had the Go Red? You started that when you were lab coordinator.
Boy, that was probably, I think,
it?
2008 was the first year we did that.
That's a on-site, on-campus activity where it's actually right now volunteer basis only, but students serve the college community with blood pressure checks, cholesterol. Well, I don't like the BMI check, but that as well.
The BMI check, the cholesterol,
you started
and
that.
blood pressure screenings. They do a lot of screenings right here every year annually on the campus.
So that's, again, I think that getting that word out that, the things that we're able to do for not only out there, but within
our own
college.
campus.
Can I just make a pause here? You're using jargon in the industry like BMI, and it would be helpful
to
if
say
you body mass index. Okay. Just to keep that in mind.
Yes.
When you're talking. So.
Good idea. Well, thank you.
Thank you.
Probably should have had her remind us earlier.
Yeah. No, that's fine. That's fine. I'm sorry.
I think body mass index is totally inaccurate. No, just kidding. Sorry.
Cut.
All right.
Insert.
The other things, though, I was hoping that you might want to, either you want to expand on is more the interprofessional relationships within the college with other health programs that we've
This is huge. And as healthcare moves forward, we're learning through research and current studies that collaboration is essential when our healthcare providers, whether they be surge techs, nurses, medical assistants, when they get into the healthcare system, that they're all working collaboratively. And we've just recently had a lot of research in this area show that this is how they need to work when they go higher into these healthcare facilities that we just mentioned, but it's not always taking place, this collaboration in the educational setting. So we're really working very hard at WCC to utilize collaboration and to have our students start collaboratively working on projects and such. And Mary, if you want to talk a little bit about
Yeah.
simulation.
Well,
and
I know
something
that,
else.
our OB instructor, Teresa Dubiel, does interdisciplinary. She involves surgical tech. She actually has a C-section, and she involves the radiology department. And they've created this C-section preoperative, intraoperative, and postoperative simulation that's just amazing, and using interdisciplinary. I know in my med-surg course, I've used the PTA programs and had the PTA students come and talk about the concept of mobility and how to safely use crutches, walkers, and canes, how to measure for them, because nurses need to know that a lot of times in the home situation, in the emergency situation, before their patient is discharged. So a lot of collaboration is really being encouraged more, interdisciplinary. And that's something that they're testing the students on in their NCLEX and their state boards of nursing. The test is about interdisciplinary collaboration. So I think it's important that we're starting to thread that all through the nursing program, and that we're not just we're not just OB, we're not just med-surg, we're integrating everything. Mm-hmm.
So how many times you see in a clinical setting a multidisciplinary conference?
Mm-hmm.
And that involves the exchange of information between the social worker, sometimes the dietitian, and as well as the physician. And the other thing, bringing back what you started on, what the research is showing that students or graduates don't do as good a job doing is the communication, the collaboration. You know,
The soft skills.
Right. How do we communicate with social work if we note maybe there's a need or some concern in the home environment, you know, and knowing how to get these other disciplines involved, and it's very important, that communication. So I see nurses more as a care manager as well as a care provider.
Absolutely.
So-
Correct.
Absolutely. I thought of one other thing, Gloria, when you'd mentioned the CENA program. Something that we do now is that we require the CENA program
Yeah, we-
for all of our admissions. I don't know if you talked
Yeah,
about that
we
yet.
did.
Yes,
And
so.
we didn't even think about that when we started the program. It was just that there
Right,
were
right.
long-term care needs, and we helped to meet those.
Yes.
And then I think one of the reasons why we adopted or added that requirement was we wanted, because the healthcare arena is changing so much, we wanted people to know what it's really like to work in healthcare. And we saw some people, it was when wages started improving, I think I'll be a nurse. And not knowing what it meant to work in healthcare, it's not an easy profession, but it's such a rewarding one. And so that's the part that we have to think about.
You mentioned a really good thing, Gloria, that it would give them a taste of what nursing is going to be like. But not only that, but it was helpful also because they're going to be supervising CNAs, certified nursing assistants, when they become RNs. So essential that they know what these certified nursing assistants do and what their duties are. So it's a kind of a win-win. And I think the community knows that we required this, and it's very valued by them when they know that our nurses had to be or were served or went through a
Correct.
CENA program.
Right. In fact, what you mentioned was our new combined program with EMU, and EMU does not have the CENA as a requirement, but they supported the fact that their students who are going to come into, the 24 students that are going to come in, have to have their CENA. So they're going to go through CENA, the CENA course here in the fall. So I think that's kind of exciting that they recognize the importance of that too.
Yeah, that is good.
Well, in terms of merging forward, what do you see as some priorities for our nursing.
I'll tell you, one thing I see is that we're gonna need to be able to respond really quickly to community needs. So in the past, maybe we could keep a program, an ADN program, and we had that for many years and it served a purpose. But what we're seeing now is the healthcare environment is changing so quickly and the needs change so quickly that our community have preparing healthcare students that as a program we're going to have to respond really quickly to needs. And one of them that I'm hearing about right now from community members is we have a large number of LPNs in Washtenaw County right now that need their RN. So this is a need we're currently looking at. And rather than, I think we had the luxury even a couple of years ago to maybe think about a program for a couple of years, mull it around. But now we got to turn things around really quickly like we did with the program with EMU. When the need's there, we need to act on it. So it's like a continual assessment we'll be doing of the community needs.
And our advisory committee is, again, we mentioned it earlier, how instrumental that group is in bringing that information to us.
Absolutely.
And
yes.
so that we can make change
Yes.
or meet their needs accordingly.
Yeah. And I don't know how much detail you did with the advisory committee, but they're key because we try to have all of our clinical sites represented so we know what's going on there and what their needs are. So they're an essential part of making the whole team work and know what we need to do and what we need to react to.
And in terms of what I see, in 2015 and 16, we are going to be preparing for our next reaccreditation visit, so that's going to take a lot of time and energy and cohesiveness to work towards that. And that also brings to mind the need to look at our curriculum and see how we can make it better. And I know a lot of what we're hearing, which with our pioneers, they talked about how before they moved to our current AAS program, the 1+1 had 92 credits. Yeah, and they had to work to whittle it down to 72. And so now, we're looking at streamlining things ourselves because in order to support what Val was saying, that BSN progression, we've got to stay, aligned with what an associate degree program should provide, and then what they need when they move into their bachelor's. So, we've got our work cut out for us, I believe, in terms of, making, or streamlining, I should say, that transition to BSN programs. So, Mary, I know you haven't been in this role that long, and I know your head's probably still spinning with learning that department chair role, but was there any other things any insights you had?
No, I think that I'm looking at really collaborating with faculty and what are faculty's needs, what are faculty wanting, what makes it work for them, because that's really important to meet where their needs are too, and have them buy into the changes and help that transition with those changes. So I see myself more as collaborator with faculty, with students, with administration, and I'm excited about the changes that are upcoming and the different roles, the different roles that department chair plays.
I'll expand on that and say, as dean of the department, I could not have done any of this without the nursing team. The nursing team is what makes this happen. And it's the collaboration and the discussions they have and the brainstorming they do that actually makes all this work and these programs come to fruition. A dean can't do that alone without an awesome program that's willing to be there.
And I'd like to even point out, though, that your role, the Dean of Health Sciences, is one of those long-coming roles, especially in to be aligned with the growing needs in healthcare, that we were, and it's just, again, moving with the times. Instead of being a part of all this other stuff, we are now, to me, I think your role has elevated our recognition within the college community. And so I see that as a very positive thing in terms of
I
our
do too.
growth.
Yeah, I think we all wanted for a long time a health dean or somebody that knew specifically about health programs.
Correct.
So I think we all feel grateful that
Yes.
we finally have,
Yeah.
that administration did acknowledge us and
Yes.
we have that role. So that's a good thing.
I think the only other thing that I think I'd like to mention is with healthcare in general, technology, and how important
Huge.
technology plays in the role of the nurse, the radiographer, any of the healthcare professionals. And I know when I had volunteered to showcase health programs with some high school students, one of the things I talked about, remember, the gadgets. We have lots of gadgets. And not everyone likes gadgets, but I find it's fun. But that is something that is going to be, I think, a core competency in healthcare. And so when we talk about our simulation experiences, that helps expose our students, I think,
Right.
to some of the technology that they're going to see out there in
Yeah,
healthcare
in
environment.
home health, there's a lot of telehealth. And so in the previous med-surg course I talked about telehealth because I've used that in my home health care experience and how it's all tied into a computer. So patients weigh themselves and it goes to a computer. They take their blood sugar and it goes to a computer. And someone is monitoring and they check their blood pressure and heart rate and it goes to a computer and someone reads that and then makes the determination, do I need to give that person a call today to find out how they're doing? Plus they can add their symptoms on there. So that's been a new type of, the technology is huge that's expanding in healthcare arenas, and students being able to do that in our simulation and having hands-on with that technology is so important, and we're really envisioning of expanding that technology access for the student body.
And Mary, when you mention that, you make me think of our students. Our students are so techy nowadays. They have the iPhones, they have their iPads, so we're learning a lot
Right.
from the students
Yes.
as we go along in this. So I'm hopeful that technology is not going to be a barrier or a stumbling block like it was in the past. We had a lot of nurses that weren't trained on computers and such, and we still have some older nurses today that struggle with having to use informatics and having to use computers at the bedside. I'm real hopeful now with our new students as they come in. They love technology. They love this, that we won't be seeing so many issues with
Right.
that. I think they're embracing this. Our students are embracing it, and because of that, we have to embrace it too. So we're learning right along with them.
Correct.
So to bring what we had closed with the first session though is really getting back to our essence though, and that's a challenge when you see the technology, those soft skills, and we've all talked about that, and we hear that from employers and
Caring.
the
Yes.
caring element, and so how can we? I mean, I think that's a challenge for us. We don't want to lose that, and I should mention that with the last poll, we're still number one with
Trust.
and
That's
high
good, right?
ethicals,
yeah.
high ethics. So I think though the people skills play a big part in that. So
Correct, but I think
Huge,
it's
huge.
modeling of faculty and administration of those soft skills too, and how we respect each other and how we treat each other. That's so important. That it's a model for the students too. And so we actually have changed that. Our students used to be calling us by our first names, and we've changed that. We've asked them to call us Mrs. or Mr. and Miss as a form of respect. And they have embraced that. Just in the last semester we've done that. So I think that there is some mutual respectfulness amongst students and faculty.
Yes, and role modeling is key. Students watch as faculty how we interact with patients, how we interact with each other. So realizing that that is so key to how our students will then perform or how they'll interact with their patients in clinical. So just really important that we're all aware of that and cognizant of that, that students watch what we do.
So with that said, we're ready to forge ahead. Go ahead, Dean, put it right there. No. Down, down, down. Okay.